It's really important for people living with HIV to take their antiretroviral therapy every day. Why? Because it keeps them healthy and stops the spread of HIV to others. Encouraging patients to take these medicines can be hard, especially if they are new to HIV or are already struggling to take their meds regularly. Here's what people living with HIV are typically told during treatment adherence support counseling.
We need to talk about your antiretroviral therapy adherence. Your HIV viral load is very high right now, meaning that you're not virologically suppressed. If you take your pills every day, your viral load will become undetectable. Your CD4 count will stay high, you won't be at risk for AIDS, and you won't be able to transmit HIV to your sexual partners.
These complicated concepts and terms can be tough to understand and internalize, but the BOK bottles make it easier. These bottles show how the HIV virus acts in a person's body and the importance of antiretroviral adherence. They show these complex concepts in a straightforward, engaging, and visual way. Here's how the same conversation using the BOK bottles might go.
Now, let's use these BOK bottles to talk about your HIV medicine. The bottles show what's happening in your body. The black beads show healthy cells, and the red beads show the HIV virus. This bottle has a mix of red and black beads. This is what it looks like in your body right now. Even though you feel completely normal because of all these healthy black beads, you can see that these red beads show the virus is getting stronger. If you're having sex, HIV can be passed to your partners. When you don't take your HIV medicine, eventually your body will look like this red bottle. You can see that there are very few healthy black beads left. This might happen slowly, or it might happen quickly, but it will happen eventually. When your body gets to this point, it's hard to fight off other sicknesses like infections and cancer. You can end up in the hospital and even die. On the other hand, if you take your HIV medication every day, your body quickly becomes like this bottle. Look, it's full of healthy black beads. This is what people mean when they talk about an undetectable viral load or a suppressed viral load. You can see there's still one red bead because there is no cure for HIV, at least not yet. However, the virus is so small and deeply buried that it can't hurt you, and it can't be passed on through sex, as long as you keep taking your HIV treatment. This is what people mean when they say undetectable equals untransmittable, or U equals U. If your body looks like this bottle, you can't pass the virus through sex, even if you don't use a condom.
Wasn't that so much more straightforward? Did you notice how much more engaged and attentive the patient was? We didn't have to use any complicated terminology, and the person living with HIV left the appointment with a simple, memorable, and powerful visual representation of HIV in the body and the importance of adherence. People living with HIV can call on these mental models later to help motivate them and remind them to take their medication, keeping themselves and their sexual partners healthy. For more information about using the BOK bottles in your HIV support practice, see the links at the end of this video, including reactions to the BOK bottles from patients and case managers in a recent study in Philadelphia. How might your organization use BOK to help end the HIV epidemic?